One of the most common and daunting challenges for orthodontists is correcting skeletal Class II malocclusions. While headgear, elastics, and other devices treat Class II cases, none simultaneously correct malocclusions while advancing the mandible. But all that has changed, thanks to Advansync. Advansync makes it possible to eliminate two distinct treatment phases and achieve skeletal correction and dental correction at the same time. With the Advansync molar-to-molar appliance, M2M, you get Class II correction in Class I time. The reason is simple. Advansync is an evolution in Herbst treatment designed to advance the mandible to a Class I position in just 6 to 9 months, while the patient has been bonded upper and lower 5 to 5. Advansync provides maximum comfort and an incredible range of motion, dramatically improving the patient experience. As with earlier Herbst technology, Advansync eliminates patient compliance. And results? Advansync produces stable skeletal changes, and it's ideal for patients in mixed or permanent dentition. Take a look at the results you can get. Advansync M2M is delivered at the initial bonding appointment and takes only 6 to 9 months, in most cases, to complete treatment. Patients are seen every 6 to 12 weeks. It starts by advancing the mandible to the desired end position and is reset at 2 to 4 millimeters every 12 weeks. And remember, all this happens simultaneously with brackets placed upper and lower 5 to 5. Molars are bracketed when the M2M treatment is complete. Advansync M2M advances the mandible while restraining maxillary growth, and clinical research shows these changes to have true, long-term effect. It immediately improves the patient's jaw position and generates forward growth of the glenoid fossae with minimal changes in the position of the condyles in the fossae. Developed in collaboration with Dr. Terry Dischinger, one of the world's leading Class II thought leaders, Advansync M2M has a number of distinct advantages, including no dependency on patient cooperation and no need for parental monitoring. Advansync's arms are 50% shorter than those used in existing Herbst appliances, minimizing mouth discomfort and cheek irritation. The appliance sits further back in the mouth, making it less noticeable than other available options. Patient adjustment is very quick. M2M doesn't interfere with daily activities, and unlike removable appliances, there are no speech problems. But even with all those advantages, perhaps the most important benefit is that Advansync gives you the ability to treat Class IIs in only 6 to 9 months while simultaneously moving teeth. Plus, Advansync is easy for doctor and staff to learn, making it easy to integrate into the clinic. Advansync makes correcting Class IIs easy for doctors and staff. It allows freedom of mechanics mesial to the molar crowns. All teeth through the bicuspids are bonded. The design is simple and streamlined, and activation is built in, so there's no need to change the arms for final activation. Here's how it works. Remove separators between teeth to seat crowns. Fit crowns on teeth one at a time and then remove to prevent aspiration, checking the size and length of the crowns. The clinician should document any large restorations on the teeth that are receiving crowns, as the crowns may need to be partially cut at the end of Class II correction. Crowns should slide over the teeth with some resistance and slide down on the occlusal surface without pinching or blanching the soft gingival tissue. If the crown is too long, you'll need to shorten it so that it doesn't impinge on the tissue. Once you shorten a crown, you'll need to crimp it around the gingival edges with a Howe plier to tighten the crown so it snaps over the tooth. Once the crown has reached approximately 3/4 of its seating position with thumb pressure, use a bite stick to complete seating. A band-removing plier will aid in removing the crown from the tooth. Dry appliance and all components thoroughly. If you've made significant adjustments to the crowns, you may wish to re-crimp if necessary, and re-micro-etch them. If you re-crimp, try not to overwork the metal edges of the crown. If you re-micro-etch the crowns, separate the mechanism from the crown, as the etching material will get inside the telescoping rods, causing it to stick. Dip the screw for the upper assembly in Sikabond. Align the upper tube's lumen with the casing on the maxillary crown and secure the screw. This is an important procedure because the Sika bond will keep the screws coming loose during treatment. And it's easier to place screws in the upper mechanism before cementation. Apply Sika bond to the lower screw after cementation of lower crown, when the lower part of the mechanism is secured. Prevent the mechanism from getting in the way during delivery by holding it up and out of the way with a rubber band. Thread the rubber band halfway through the lower eyelid and collapse the extended telescoping arm into itself, keeping the mechanism very short. Next, loop both ends of the rubber band around the mechanism. Then attach both ends of the rubber band to the hook on the arch wire tubes. To keep glass ionomer out of the mechanism, place toothpaste in any open areas of the appliance's components. This includes upper tubes, upper and lower arch wire slots, and both axles. Avoid getting toothpaste inside the crowns as it may contaminate the cement and weaken the bond. Mix the cement and place it in the crowns. Crown should be 1/2 to 2/3 full with cement. It's best to use a cold slab when mixing the cement. A glass ionomer or dual cure light activated adhesive is recommended. If you're using a dual cure adhesive and are delayed a few minutes before cementation, place an orange light box over the cement-filled crowns on the cold slab to keep the material from starting to cure too early because of the overhead lights. Cement the lower crowns and then cement the upper crowns with the pre-attached mechanism. Clean residual cement from the teeth using a cotton roll. Let cement cure according to manufacturer's instructions. Since the tops are cut out of the crown, you should clean off any excess cement on the occlusal surface. This will make it easier to remove the crowns later and decrease the amount of time needed for cleanup. Then, thoroughly clean the teeth of any excess adhesive, being careful to keep a smooth closed seal between the adhesive and the edge of the crown on the occlusal surface. Place the lower arch wire before removing the rubber band that holds up the mechanism. Then, draw the lower telescoping mechanism forward and align it with the lower mesial casing. Insert a screw that's been dipped in Sika bond through the lumen into lower mesial casing. At the initial insertion, the patient may be advanced edge to edge or to a class 1 relationship. It's sometimes necessary to use C-spacers of different sizes on each side, adding a millimeter or two to one side to correct any midline discrepancy. Advansync uses C-spacers specifically developed for this mechanism. If C-spacers or C-rings from other manufacturers are used, they will jam the mechanism and may damage the telescoping rods. The telescoping rods do not need to be disengaged in order to place the C-spacers. Simply have patient open his or her mouth, place C-spacers over the rod, then crimp with the Ormco C-spacer crimping plier. The C-spacers will slide up and down the rod. Activation and advancement will occur 6 to 12 weeks following initial insertion. For the initial activation, use the C-spacers to move the jaw forward. To further extend the M2M mechanism and put on additional C-spacers, have the patient open his or her mouth and place new spacers over the tube closest to the lower lumen. Slide C-spacers over the rod. Let C-spacers slide until they rest at the base of the eyelet. Crimp the spacers down with Ormco C-spacer pliers. The C-spacers are dead soft and will crimp easily. The C-spacers will slide up and down on the rod. If C-spacers no longer fit on the rod or first tube of the mechanism, remove the screw from the mesial screw housing and move it to the distal screw housing. At each activation appointment, it's important to check to see that the telescope is functioning correctly, the midlines are in their correct relation, and to see if there is an open bite in the bicuspid area. If there is an open bite in the bicuspid area, the lower first and second bicuspid brackets will need to be rebonded. You'll place these brackets lower on the teeth. Because we want the lower arch level for posterior contact when the M2M is removed, watch to make sure that the cusp tips on the lower bicuspids are the same height as the cusp tips on the lower molar crowns. If the brackets are not placed low enough to achieve this cuspal relationship, an open bite can present in the area of the bicuspids. When bonding or rebonding teeth, never micro-etch the teeth with the M2M telescope mechanisms in the mouth.